Um, so today we're going to be talking about a product called Kanna, which is spelled K-A-N-N-A, Kanna, not to be confused with kava, which is a popular plant compound. Kanna comes from a plant that has been grown for millennia in South Africa. It is a very interesting compound from a historic perspective because it was used in tribal society to increase energy for natives prior to going hunting. And it's one of these compounds that survived throughout the generations. What's interesting about it is the mechanism of action. We don't understand a lot about mechanism of action for plants, in particular because not a lot of research has been done on the biokinetics, the biopharmacology of how these plants actually work. But with Kanna, we do have really good, clear data on how this particular plant works. Because a small company, a pharmaceutical company out of South Africa, took the compound, isolated it from the plant, and essentially found out what it was made of and how it worked. And what's really interesting about what they did is they ran it head-to-head as a placebo-controlled trial, an active placebo, and compared it to serotonin reuptake inhibitors. And they noticed that this particular compound was just as effective for treatment of anxiety and depression disorders as the pharmaceutical compounds. There are three primary active compounds in Kanna. The first is Mesembrine, and it's 80% of what's in this particular compound. Now, Mesembrine works on serotonin. It is a potent serotonin reuptake inhibitor, but it's a partial serotonin reuptake inhibitor, which is really important because a lot of people, if you know about plant medicine, know that almost all plants work on serotonin or dopamine or acetylcholine, and all of these are very potent neurotransmitters. So when you overwhelm the system, what happens with serotonin or dopamine or acetylcholine is you get a pretty broad effect and you have a pretty broad side effect. And that's why when we look at things like SSRIs have a lot of side effects. Yes, they help people with depression, but they also might cause libido dysfunction. They may also cause sleeplessness. They may also, in many cases, worsen anxiety before it gets better. So when we look at the primary active compounds, we look at Mesembrine, and we know that it's a serotonin reuptake inhibitor. That's interesting. However, what's more interesting is one of the other compounds in the plant, and it's called Mesembrenone, and that's about 15% of the bioactive compound in Kanna. And that actually functions as what's called a PDE4 inhibitor, and phosphodiesterase inhibitors or probably some of the most interesting drugs that are on the market. You know, if we really want to think about the research that's going into cardiovascular drugs, drugs that treat COPD, the drugs that are treating neuroinflammatory disorders, those are all phosphodiesterase inhibitors. Actually, one of the biggest blockbuster phosphodiesterase inhibitors was a PDE5 inhibitor called Viagra, multi-billion-dollar campaign. So again, coming back to phosphodiesterase, the reason we care about it is because when we think about these primary neurotransmitters, phosphodiesterase is a higher order regulator of these neurotransmitters. It doesn't just work on these huge broad axis systems like acetylcholine, serotonin, and dopamine. It works to regulate what's called the postsynaptic effect of many of these neurotransmitters. So Mesembrenone, that 15% bioactive compound, is a potent PDE4 inhibitor. It supports cognitive function, neuroprotection, anti-inflammatory effects. There's another important compound in here, and it's called delta-7 mesembrenone, and that's about 5% of the bioactivity of this compound. And there's a lot of research looking at this and how it contributes to stress regulation and emotional flexibility. So these are very important, very interesting plant alkaloids. Almost all of the pharmaceutical drugs that have been tested for neuropharmacology, many of them originated from simple plant compounds before they were ever synthesized as pharmaceutical drugs. Now we have the capacity to kind of target specific receptors, build very specific neuromodulators, and that's what most neuropharmacology does. Oftentimes for most of these drugs, we actually don't know how they work, even though they've spent billions of dollars and done tons and tons of clinical research trying to figure out exactly how these compounds work. So getting back to Kanna, mechanisms of action. Serotonin modulation. It increases serotonin levels in the brain by blocking reuptake. Similar to SSRIs, but they don't have the same side effect profile. You don't tend to get these major SSRI side effects with Kanna that you do with SSRIs. Neurotransmitter support, and that's regulating dopamine, that's regulating the noradrenaline pathways, things that enhance motivation, pleasure, stress adaptation. The science of neuroinflammation is probably one of the most interesting and novel therapeutic pathways that's being looked at right now for things like treating and preventing neurodegenerative diseases. And almost all of the drugs that have shown any efficacy at this point, and the newer studies on these drugs, are all phosphodiesterase inhibitors. So super interesting pathway here. Short-term benefits. So how do you take this? So it's basically a tincture. It's an organically sourced, sustainable extract from the Kanna plant, and it's put in a pineapple extract because we know that Kanna root is quite bitter and not palatable, but when it's mixed with a pineapple, it's actually quite good. It's you don't taste the bitter effects. It's quite a nice sensation. You just put it under your tongue, let it sit there, hold it in your mouth for about 30 seconds, and then swallow it. So it's a pretty rapid onset, and we're talking within about 15 minutes to 30 minutes, we get this kind of calm, grounded energy that you feel from this compound. What we find is that there's some reduction in anxiety, some improvement in focus. It also has this interesting effect that it increases the emotional openness and awareness, kind of enhances mood and sociability. You could use it in place of things like alcohol or other kind of stimulants people are using for social situations. A lot of people drink alcohol, which we know the major adverse effects of alcohol are many and profound. Kanna does not have any adverse effects taken at these types of doses or even at high doses, but it has a very nice feel to it. Long-term benefits. Always interested in things that promote neuroplasticity and emotional resilience. I think some of the studies looking at these head-to-head comparisons with Kanna and SSRIs have shown that. Supporting the recalibration of the nervous system, especially for people who are recovering from chronic stress or emotional trauma. It acts as a mild nootropic. Now, nootropics are various, and it's kind of become a buzzword nowadays, but the concept is giving your brain the ability to regulate itself. So instead of using strong compounds that affect dopamine, serotonin, and acetylcholine, using compounds that modulate their activity at the receptor site for the goal of enhancing brain health and cognitive longevity. From a safety standpoint, it's non-addictive, it's not hallucinogenic. No matter how much of a dose that you take, you're not going to have a dissociative experience. Some of the side effects are pretty mild. For some people, there can be some kind of mild GI side effects. I don't notice that. Some of it can just promote GI motility. So if you're someone who needs something to kind of get your gut moving, I think Kanna is a great compound for doing that. It's sustainably grown in South Africa. There's no pesticides, there's no synthetic fertilizers. The Kanna Feels product that we're looking at uses a heatless extraction process using glycerin instead of alcohol. Most of the ways of doing extractions are not cold extractions, which really affects the quality. Alcohol can destroy some of these alkaloids. They can, of course, alcohol can also cause a lot of other problems with the compounds themselves in terms of even absorption. So we don't like things that are extracted with alcohol. We certainly don't like products which use heat extraction rather than cold extraction. Because they're gentler on the system, they have high bioavailability, and the compounds that we're trying to get out of this are preserved. So as if you were to take the root itself and grind it up and make a tea out of it. This is probably a much better way of getting it into your system, even though it has some minimal processing, because it's more concentrated. The flavor is better. It's easier to use. It's in a small dropper that you can literally take 0.5 mLs and put right under your tongue. I've tried this for many days in a row. I think for most people, I'd recommend probably doing it, 2 to 3 weeks. In particular, for using it as a mood lifter, has a similar feel as if you were kind of having a nice coffee. If you're a person who enjoys caffeine, you get that kind of openness, awareness, increased sociability, increased focus. But you don't tend to have the same crash that many people have with caffeine. When most people take caffeine, that is a short-lived effect. Maybe it lasts 1 to 2 hours, and then a little later after that, you feel like you need a little bit more. And that's not what you get with Kanna. Kanna is more of a 8 to 10 hour effect, depending on the dose. And then you kind of gradually decline with that feeling. It doesn't seem to impact sleep as well negatively. I've had some patients use it and tell me that their sleep is actually improved, even taking it before bedtime. So that's Kanna today. Thanks for checking in with us. Thanks for listening in. And if you have any more questions, please reach out to Kanna Feels. You can also reach out to our clinic at KenshoWellbeing.com, and we'll get you set up.